Hello everyone, welcome back to my channel. This is your consulting oral surgeon Dr. Amina, and today is my day for daily dental blogs, and today for my first consultancy I am heading towards Itanagar. Unlike Naharlagan, the road condition of Itanagar is awesome. I am heading towards Akasdeep Itanagar. आकाशदीप इज़ द ओल्डेस्ट मार्केट ऑफ आवर ट्विन कैपिटल। पहले बहुत छोटा सा था, बट हम लोग सब लोग वहीं पे जाता था कुछ भी चीज़ के लिए। अभी बहुत बड़ा हो गया समय के साथ, जस्ट लाइक अस एज वी ग्रो अप. So now it feels good that there's a dental clinic and to be working as a visiting doctor in Akasdeep. Every time I see my name like this, it makes me kinda emotional, and I pray to God that I can give my best service to the patient. So today I'm supposed to operate a case of impaction, but only if the blood test reports are normal. The same patient was scheduled last time, but only in last moment the patient reported us about hepatitis C. So the procedure was put to halt and patient was asked to undergo some blood test report. Also the patient is diagnosed with epilepsy. So today I'll be discussing what are the needed precautions for patients diagnosed with hepatitis C and epilepsy and how it is related with dentistry. Firstly, the compulsory BTCT report, the bleeding time and the clotting time for any minor oral surgery. You can see BTCT reports are normal. Then we go for the CBC report. We need to see the hemoglobin. So you can see that the hemoglobin is at border level, but still if the surgeon is confident, he or she can proceed for the surgery because it is a minor oral surgery procedure. And then we need to look for the platelet count, because if the platelet count is not normal, the bleeding will not stop. There will be no clotting factor. So you can see the platelet count is drastically reduced here. Normal platelet count is 1.5 lakh to 4 lakh, but in this scenario it is only 29,000. So this is a sign of emergency. The patient needs to report immediately to a general medicine specialist because a platelet count below 50,000 indicate a platelet IV infusion. Since the patient is hepatitis C positive, there is a high chance of liver cirrhosis. So LFT, that is liver function test, reports are compulsory. So you can see that in the LFT test, both the enzymes SGPT and SGOT are excessively elevated. Therefore, there is a chance of cellular damage in the liver. So the renal function test is clear, everything is normal. HIB, HbSSG is also negative, so patient is hepatitis C positive. Whenever the patient is giving a history of drug addiction in the past, always be alert about HIV and HbSAg, and also there's a chance of epilepsy, so always ask these questions to the patient. And after that, it's important to give a hepatologist reference or whatsoever specialist that is required for the particular diagnosis. And yes, last but not the least, universal precautions should always be taken while operating a case of hepatitis patient. Now coming to the epileptic part, it is always important to ask whether the patient is undergoing medication, because sometimes the physicians terminate the medication. In these cases, there is chances of recurrence of these seizures. So it is very important to ask, and the patient should be asked to take his medication, and 0.5 milligram of diazepam a night before would do no harm as per my clinical experience. But still you need to consult a neurologist. Number 2, psychological stress can increase the likelihood of a seizure development. Therefore, in order to control the stress, it is very important to talk to the patient, to be friendly with the patient so that the patient is free of stress. Talking directly or indirectly reduces the stress. Number 3, the use of alcohol is definitely contraindicated in epileptic patient because it may precipitate the seizure. Therefore, do postpone the treatment. It means it is not much of any danger and it is within a span of 5 minutes. But status epilepticus, it lasts more than 5 minutes and it can go out of control. Number 4, ask the patient if he have ever been hospitalized for a very long time because of this seizure. Because most of this seizure, except for status epilepticus, it is self-limiting. Self-limiting means it is not more than 5 minutes. But status epilepticus, it can last for more than 5 minutes and it can go up to 10 to 15 to 20 minutes, which is very much life-threatening. So even after all the precaution, if by chance seizures happens in your dental chair, it is important that 2%, one of them should hold the leg and one should be in the chest area to control the hand, because most of the time patient may directly fall from the chair and may injure himself or herself. Fortunately, our dental chair are as so designed that the headrests on most dental units are normally well padded so that no additional protection is necessary for the head. And please do not try to put anything in the mouth because it can cause possible danger to both the patient as well as the rescuer. After consulting my first patient, and now I'm heading towards my second patient of the day. My second patient is a case of an extraction of an upper third molar. So whenever you're extracting a tooth, visibility is very important. In order to achieve visibility in a maxillary upper third molar, it is important to ask the patient to decrease the mouth opening a little. And after that to retract the cheek with a retractor. It's always important to check the status of the second molar so that later the patient won't blame on you. Therefore, check the TOP, whether it is present in the second molar and the first molar from before itself. You can see clinically that the third molar is very much buccally tilted. So I've used a luxator firstly. With the luxator, I have luxated the tooth out a little bit. In the x-ray, you can see there's a space between the second and the third molar where I can put my luxator in. Now after luxating out the tooth a bit, I'm using a forceps. So forceps extraction is the best extraction as possible. If you are a newbie, I'm using a forceps here because while luxating, I just felt like I'm putting a little bit force on the second molar due to the anatomy of the tooth place. The movements for the third molar extraction are apical bucco-distal movement. You need to move it buccally and then rotate towards the distal side. And tada, here's the tooth extracted out. You can see here the roots are too much divergent, which I was feeling it while luxating. I felt like it is diverging towards the second molar and giving a pressure towards it. Hence, I was using a forceps after luxating a little bit. Apart from the bookish knowledge, I would say that you need to trust your instinct and also your own clinical experience and your own comfort. I usually just need a luxator to remove a third molar simple extraction. But in this scenario, you can see that there are 4 divergent roots. And now heading towards my third consultancy. I was called for this consultancy because they said that the patient had TMJ problem. This was a refer case. So now on examining the patient.
कहाँ में दिखाओ, हाथ लगा के दिखाओ। इसमें दर्द हो रहा है? कब से हो रहा है? कहाँ इसमें हो रहा है? इसमें नहीं हो रहा है ना? इसमें ना? कब कब दर्द होता है?
So on examining the patient intraorally, you can see that actually the patient is having problem in the denture. The denture is of very much loose fit. It has no stability and it is impinging in the distal area region, and even the occlusion is deranged. Because of the loose fit of the denture and because of its extreme large size, it is impinging towards the distal border region, and hence the pain is radiating towards the masseter muscle area. If you look at the video, you can see that it is a clear-cut case of alveoloplasty. The alveolar ridge is not smoothened. It has lots of bony spicules, and no matter how much good amount of a ridge you may have, but still if the alveolar ridge is not smoothened, the denture is not going to achieve its stability. Even though the ridge here is a class 1 alveolar ridge quality. Therefore, firstly, we need to undergo alveoloplasty, that is smoothen the alveolar ridge area. Only then after a month we can go for complete denture. So the patient was educated along with his son, and then we asked them for a follow-up whenever they are ready for an alveoloplasty. So my fourth patient of the day in the same clinic was a case of an implant follow-up. But I guess the video is going to be too long. Therefore, I'll end my video here. Thank you so much for watching my video. Please do not forget to like, share, subscribe and comment. And if you have any doubts, you can comment in the comment section. Thank you.